Hi, and thanks for joining today. At FloridaBlue Medicare, we have been helping seniors achieve better health for over 50 years. An unwavering commitment that goes beyond the Floridians we insure to an entire state we call home. We know that a book on Medicare has never been considered a real page-turner, but we think you'll agree that this one is different. We understand that there is no such thing as one-size-fits-all when it comes to a healthcare plan. That's why FloridaBlue Medicare is committed to a community of care, ensuring that you get the benefits that matter most with the expert guidance that you deserve. It's a comprehensive approach to your care. It's caring for your individual health needs and budget. FloridaBlue Medicare has a network of local providers and clinics, personalized service and plans that fit your life. We have life-enhancing wellness programs, cutting-edge technology to serve you online, neighborhood Florida Blue centers, and local agents. Choosing FloridaBlue Medicare means choosing a community of complete care dedicated to your health and well-being. In the next few minutes, we'll share 4 important chapters to help you find the Medicare plan that's best for you. Medicare options, FloridaBlue Medicare plans, prescription drug coverage. What's next? But before we can go any further, you should know that there are specific times when you can enroll, disenroll, or change your Medicare plan. The annual election period, or AEP, is from October 15th through December 7th of every year. The initial election period, or IEP, is the first time you can sign up for Medicare. And it starts 3 months before your 65th birthday and continues through the month of your birthday, and 3 months after your birthday. During the rest of the year, if certain conditions apply, you may qualify for a special enrollment period, or SEP. When it comes to Medicare coverage, you have 3 options. Some plans may be a better fit for you, your health, your finances, and your goals. So let's look more closely at the 3 options. Option 1 is usually called Original Medicare, and it includes Parts A and B. Parts A and B cover doctor and hospital costs, but do not include coverage for outpatient prescription drugs. So you may need a separate Medicare prescription drug plan. If you do not select Part D coverage when you first become eligible for Medicare, you may be subject to late enrollment premium penalties that will be put in place for the duration of your prescription plan enrollment. Option 2 is Original Medicare plus a Medicare supplement policy and prescription drug plan. A Medicare supplement insurance plan, or Medigap policy, helps lower costs by paying deductibles and co-insurance that Original Medicare does not cover. But these plans do not offer prescription drug coverage. If you need drug coverage, you can add a Part D prescription drug plan, also called PDP. Option 3 is enrolling in a Medicare Advantage plan, which are offered by private insurance companies like FloridaBlue Medicare. These plans combine the benefits of Original Medicare Parts A and B and provide additional coverage like dental, hearing, vision, and fitness memberships. They can offer lower out-of-pocket cost, and many include prescription drug coverage. FloridaBlue Medicare also offers extra health benefits, like virtual telehealth visits that enable you to speak with medical and behavioral physicians on your phone, computer, or personal device. You can even earn rewards through our Healthy Blue Rewards program for getting the care you need to feel your best. Our goal is to give you the healthcare benefits and services that enable you to focus on enjoying your life. Life is about living. It's about your family and friends and pursuing your passions for many more years. A new opportunity to make the rest of your life the best of your life. So, now that you've seen the basic options, how do you choose your plan? Start by asking yourself, what coverage do I have now? What do I like about it? What would I add or change to make it the perfect coverage for my lifestyle? Is someone helping me make healthcare decisions? These questions will help in our next chapter on FloridaBlue Medicare plans. FloridaBlue Medicare has two types of Medicare Advantage plans: HMO, which is short for Health Maintenance Organization, and PPO, which stands for Preferred Provider Organization. In an HMO, you choose your primary care provider from the plan's network. The doctors in our FloridaBlue Medicare network agree to accept a discounted rate, and in most cases, we pass that savings on to you. As a result, out-of-pocket costs with an HMO will often be lower than original Medicare. In general, we do not cover care from an out-of-network doctor unless you need emergency or urgent care out of the area, or you have an approved referral from your primary care provider. Most HMO plans require a referral for a specialist visit. If your current doctor is not in the FloridaBlue Medicare network, these savings and the plan's other benefits may be worth changing your doctor. It is important to note that the Centers for Medicare and Medicaid Services prohibits combining a standalone prescription drug plan and a Medicare Advantage HMO, even if the HMO doesn't include prescription drug coverage. Ask your licensed sales agent if the HMO plan in your area is right for you. With a PPO, you can select doctors from inside the FloridaBlue network for the greatest savings, but you have the flexibility to use healthcare providers who are not part of the network. This includes when you travel out of state. But unless you are seeking care due to an emergency, going outside of your network may result in higher out-of-pocket expenses. You can talk to your local licensed sales agent to see if a PPO is the right plan for you. Okay, let's tackle Part D, prescription drug coverage. Prescription drug coverage is offered through standalone prescription drug plans, also called PDPs, or through Medicare Advantage prescription drug plans, MAPDs. FloridaBlue Medicare's drug list will let you know which drugs are covered in each plan. This is called our formulary. Each drug belongs to a tier, which determines how much you'll pay for that drug. Even if your medicine is listed, in some cases, FloridaBlue Medicare may require you to try certain drugs first to treat your health problem before we'll cover a more expensive drug. This is called step therapy. Not all name-brand drugs may be covered, as manufacturers must agree with CMS's terms and conditions to contract with Medicare. Now, let's talk about the different Medicare drug coverage stages. During the initial coverage stage, you pay a copay or percentage of the drug costs, known as coinsurance, for each prescription, and your plan pays the balance of the costs until you reach a set amount. In the catastrophic phase, you stay in this stage until your policy is renewed on January 1st. Your local sales agent will be able to answer any additional questions you have on prescription drug coverage. And remember that Medicare provides extra help to help pay prescription drug costs for people who have limited income and resources. Ask your licensed sales agent for extra help if you think you might qualify. Now that you know more about when to sign up for Medicare, your Medicare plan options, and prescription drug coverage, you're ready to work with your local licensed sales agent. They will make sure you qualify, help answer any questions you have, and help you decide which plan is best for you. In a few moments, your sales agent will go over 3 important documents: the summary of benefits for the plans available in your area, the plan's star ratings, and the plan's covered drug list called a formulary. Once you've enrolled in FloridaBlue Medicare, your application will be processed and you will receive your FloridaBlue Medicare member ID card. Your member benefit package will arrive. You can enroll in our online portal and complete your health risk assessment and get access to our rewards program. This is what it looks like to have a community of healthcare experts advocating for your health and providing a comprehensive approach to your care. It's caring for your individual health needs and budget. FloridaBlue Medicare has an unwavering commitment that goes beyond the Floridians we insure to an entire state we call home. Thank you for spending time with us today to learn about FloridaBlue Medicare. We are committed to your health and wellness. Your licensed FloridaBlue agent, who presents your specific plan benefits to you today, can answer any questions you have. Thank you.